Well, my name is Colleen Messner. I'm a registered nurse by profession. I've been a nurse for over 30 years now, with a varied background. I worked in a hospital, to a surgical center, to home care, to a neurology clinic, community health, public health. That's been most of my background. Right now I work for Casa Alba Melanie, the Hispanic Resource Center in Green Bay, helping anyone that walks through our doors with any medical questions or problems that they may have. I worked for 10 years doing the vision and hearing screenings for Brown County Public Health Department. As part of that, I worked with the Lions Club and Medical College of Wisconsin, Dr. Hunsicker, in formulating the Lions study that they are continuing to try and facilitate. I feel like they formulated a lot of it based on what we did at Brown County. Doing the vision screenings there, we were certified for prevent blindness and had done chart screenings until the Lions presented us with the photorefractor, and at that point we added the photorefractor to our chart screenings so that we could keep our own statistics and comparisons on the outcomes of it. So it was very interesting, and it's a good tool to have as an addition to our chart screening. So my current position as a Spanish Health Navigator Program Coordinator, again, we help people with any sort of health related issues that they come to us with, whether it be paying for health care or finding a provider. We are going to begin adding some screenings to our services, like a health risk assessment screening where we do blood sugar, cholesterol, height, weight, BMI. In addition to that, we are going to add vision screening and link people with optical resources and perhaps vision vouchers when needed if they can't afford to pay for eye exams and glasses. Chart screening versus photorefractor screening is interesting. When I worked at Brown County Public Health, we kept statistics on the outcomes. We screened around over 12,000 students a year. Just shy of 3,000 were typically referred. We kept stats on how many were referred based on the chart only, how many were referred based on the photorefractor only, and how many were referred based on they failed both screening tests. 43% were referred with just the chart, 13% were referred with just the photorefractor, and 44.7 failed both. So that was the overlap there. So it's interesting to me. I feel like the chart screening picked up things like amblyopia, where one eye isn't working well and wasn't communicating with the brain, whereas the photorefractor did pick up refractive issues, and 13% of the time it picked up things that we wouldn't have caught with the chart screening alone. So that was interesting to me. I felt, in order not to leave anyone behind, the combination of the two tools were beneficial. But given time constraints and factors, photorefractor is much quicker, didn't require as much cooperation. Sometimes chart screening is difficult, especially with little kids. You have people trying to cheat with the chart screening too, and you couldn't cheat with the photorefractor, so that was a whole nother issue.